Good evening and welcome to the February membership meeting of the Cuyahoga County Progressive Caucus. I'm Steve Haleko. I'm the political director of the caucus. And before we get started, just a little something on how we've managed to do business since COVID with numerous Zoom meetings. And that is, we don't put a lot of links in the chat. And the reason for that is people are going back and forth trying to find the link, and then they miss something in the meeting. So what we're going to do is we're going to send all of you an email tomorrow that will be a comprehensive listing of links and everything that we talk about at tonight's meeting. That email will also have become a member of the Cuyahoga County Progressive Caucus. And we always get like people who come to meetings, they see it on Facebook who aren't members. And chances are, if you are not a member and you're at this meeting, you will like what you hear and become a member. Membership in our organization is free. We'll also have a donate link. We are all volunteer funded, all volunteer staffed, and we depend on your small contributions to keep our organization going, pay our office rent, our server to send out thousands of emails, et cetera, et cetera. You'll also get, because this email is going out to folks who registered and then decided they couldn't make it, you'll get a link to the video of this meeting. CCPC actually has a YouTube channel. All of our meetings are on there. And if you like what you hear in this meeting and want to share that, that would be great. Now, after the various segments of the program, we are going to ask if you guys have any questions. So I'm going to introduce our tech person, Deb Klein. Deb, please explain how we will do the question and answer period. Deb, we cannot hear you.
Muted myself. We have two ways that you can ask a question. You can put it in the chat and then I will read it for you, or you can raise your hand. And when you raise your hand, go down to the reactions button at the bottom of your screen and use the raised hand feature because it puts you up in a queue. So either way, you can do that if you need to ask a question.
Thank you, Deb. We have two main features tonight, and they kind of piggyback off each other. One is an exciting new program called Care for CLE, which is a program that's designed to have care response available to Cleveland citizens, when they have a mental health issue or something like that, as opposed to the police coming and the probability of something going wrong rises drastically. And the other, I'm going to talk about this after we get done talking about Care for CLE, is our most important campaign over the next month, and that is to get Progressive Matthew On elected to the county prosecutor's position. So let me introduce our main speaker tonight from Policy Matters. Bree Easterling is going to explain what Care for CLE is. Bree, thank you.
Thank you. Thanks, Steve, and thanks, Deb, and everyone for having me tonight. Yes, my name is Bree. My pronouns are they, them, and I'm the social justice outreach and organizing specialist at Policy Matters Ohio, and also one of the proud founding members of the Care for Clee Coalition, and a close partnership with REACH in NEO, which stands for Responding with Empathy, Access, and Community Healing of Northeast Ohio, whose organization were kind of the trailblazers for formulating something like this for Cleveland. And without further ado, I'm going to go ahead and share my slides. Is that okay now? Deb? Okay, cool.
Yep.
So yes, Care for Clee is the coalition here in Cleveland, advocating for a non-police care response. And for those of you on this call today, whose first time it is hearing about a care response or a non-police crisis response, also known as alternative response, we'll get into the weeds of that a little bit here shortly. First, I wanted to highlight the Care for Clee Coalition. Why us, why now? And ultimately, this coalition came together with a shared interest of addressing these socioeconomic issues like poverty, substance use, racism, and all sorts of other traumas that our neighbors have experienced and are experiencing, and addressing those issues through a health first approach. And with that, uh, came up uh, a non-police response because police aren't needed for these sorts of things. The the Cleveland's Mental Health Response Advisory Committee reported that for 2 years running, almost 90% of all incidents responded to by Cleveland's Crisis Intervention Team, otherwise known as CIT. Officers involved someone with mental health symptoms. And so for these struggles are essentially reflected in our community's public safety and health statistics. Um, as it shows right here, COVID only made matters worse for us, with Cleveland first responders reporting the rising rates of depression, anxiety, substance use, and other behavioral health needs. For the Mental Health Response Advisory Committee, this particular committee was developed as part of a settlement agreement in September 2015 to provide feedback um, and support, amongst other things, to Cleveland's Division of Police. Essentially, it was birthed out of the consent decree as it relates to the coordination of crisis intervention activities. Um, and again, that settlement agreement between the city of Cleveland and the Department of Justice, otherwise known as the consent decree. And so, even with this percentage being so high, with almost 90% of all the incidents being responded to involving a mental health crisis, the city still, continues to dispatch police officers and not mental health care specialists to mental health crisis calls, which again prompted the mobilization to formulate a coalition like Care for Clee. So getting into the types of crisis response. So we have a COP response, which is a call for help is responded to by the police. And then we have the co-response, which incorporates that CIT model, or the crisis intervention trained officers paired with a social worker to respond to emergency crisis. And then we have care response that doesn't involve police at all, and it incorporates a mental health professional EMT nurse alongside a peer support specialist or other crisis intervention. Okay. And so these are just some of the key features of care response that REACH as well as the Care for CLE coalition has laid out and advocates for, and how a care response could work for our city and our county. And so how we envision it is operating under a community advisory body, and with the ability to dispatch care responders directly to 911 calls, including certified peer responders. So including, those folks that have the lived experiences that are similar to the people that are actually that are experiencing the crisis that are being responded to. And also a connection to a wide range of healthcare providers to offer somewhere to go for someone in crisis, which is one of the key factors, right? Like, we can address their crisis, we can meet the person where they're at, but if where they are is where the crisis is where the traumatic event occurred, or is putting their safety at risk, people need to have somewhere safe to go, and somewhere safe to be properly treated. And not lastly, but just one of the last key highlights here is a program planning process that solicits in response to the feedback of directly impacted community members. So, not just considering, but prioritizing the feedback that community members, have provided, and really, really leaning into collaborating. This should be a partnership with not just like our local health departments and service providers, but also key stakeholders also involve community members, particularly those most impacted. And so, what Clevelanders say. Right here is a rough layout of or overview of the first phase of a directly impacted community survey that we did. I'm not sure where those markings came from, but it might have been from when I was fiddling around with the presentation on my phone earlier. But so in advocating for a care response pilot, REACH partnered with Policy Matters Ohio as well as other community organizations to provide a directly impacted survey, is what we called it. And the first phase consisted of a collaboration with NEOC and their homeless Congress, where they went out and conducted these surveys exclusively to people who had experience being unhoused, to see what their what their perspective was and what their experience had been with not even just exclusively police, but the entire umbrella of first responders, so police, EMT, and firefighters. And this is just a graph that breaks down what one of the survey questions that says, if you've had more than one interaction with a first responder in the past year, how would you describe them? And right here is a quote that was also pulled out from the very in-depth survey that we did. The survey consisted of I want to say at least 20 questions, very balanced between qualitative and quantitative data. So really getting really getting in the details and allowing folks to really express what their experience has been like here in Cleveland with first responders. We just wrapped up phase 2 and are currently in the process of disaggregating the data around phase 2 of this survey, which is the portion of the project that I spearheaded, and it consisted of the target populations of people who have experienced severe mental illness, the LGBTQIA plus community, underprotected and over policed neighborhoods of Cleveland, and people who have experienced substance use disorders. We received just under 600 responses for that, and we'll plan on releasing a report based off of those findings here around mid-year. You should be expecting that. And so getting into other areas, or what we consider some of our sister cities that have implemented an alternative response to address crises. This is just a brief overview of what that looks like in Cincinnati. And so like their teams and I feel like that's was one of the more beautiful and unique things about also really implementing something like this as innovative as a program like this would consist of, in terms of how that looks in reimagining public safety, really decarcerating and decriminalizing mental health, decriminalizing homelessness, decriminalizing marginalized identities that have historically been criminalized. And it looks different. One of the things that I've loved about really getting into this work and is really seeing how unique every program is, and how it's tailored to that specific city or that specific area. And so this is what it looks like in Cincinnati. The city 911 dispatch routes calls that meet predetermined specifications to the alternative response crisis team. It consists of the fire department, firefighters, and paramedics. So again, it looks different in every city. Some cities have peer support specialists with medics. For Cincinnati is firefighters and paramedics. And they also provide clinical de-escalation. They provide clinical de-escalation, medical assessment, crisis intervention, transportation, and connection to community resources, and basic needs like food and clothing. In Dayton, the teams are made up of social workers and counselors. And these team members have prior experience in victim services, children's services, juvenile detention, law enforcement, and other areas of community response. Has its own hotline and can also receive 911 calls. And they specialize in conflict mediation, de-escalation, and again, connection to services. And so for care response in Cleveland and what that current landscape looks like, the Adams Board allocated $2.5 million towards a care response pilot, I believe back in November. And the pilot is slated to take place in the 44105 and 44102 zip codes. So near West Side, Edgewater, Cadell, Denison, Madison neighborhoods, And then the 44105, which I believe is like Central Slavic Village, Old Brooklyn neighborhoods. There will be 5 pair teams of mental health providers and peer support specialists. And there's been talks of the pilot launching as soon as this summer. But right now, the Adams Board is currently hosting a series of community meetings to share information about the pilot and also garner feedback from community members about their take on pioneering a care response pilot. The first meeting was held last Thursday at Miles Elementary, and I also have the upcoming meetings and a link that Steve will be able to provide in the follow-up from this meeting. But I did, in case anybody just wanted to get a brief quick look at what days and times the next meetings are. I added that to this last slide here. So the next one will be this Thursday, actually, at the Zoom location. And the link that I provide will have the Zoom registration link also. But it would be this Thursday from 11 to 12:30. And there'll be a series of them throughout the rest of this month and into next month. And that was really all I had. I didn't want to overwhelm anyone with too much information and getting in the weeds of things, but did just want to give a thorough overview of what care response is, how Care for Cle came about, and what that landscape looks like here in Cleveland, as well as some of our sister cities. And with that, I'll pass it over to Steve and see if there's any questions or comments or anything I may have missed. I think I've seen a few of my close colleagues here tonight, Josiah and Pete. Josiah is the co-founder of Reach, and Pete is a senior researcher who I work very closely with in the criminal legal issues. But he's a senior researcher at Policy Matters Ohio. So I thank y'all for being here and supporting me as well. And please feel free to jump in case there was anything pertinent that I may have missed.
Does anyone have any questions? Okay, Eric, you have to unmute.
Yep.
Go ahead.
Yeah, I guess to get a little more in the weeds, I was just wondering, because some stuff I've read recently about how like dispatch centers work in different places, like what exactly that'll look like in terms of like making sure the right calls get routed to care response, because I know that's been an issue in this area. And I saw in one of the other city examples that said calls that have certain characteristics will be referred. I was kind of wondering, I mean, is that like by an algorithm or does an actual human being do it? Just if you get not super in depth, but like sort of a picture of like how it works now and how it ideally would work if we had this.
Yeah, sure. And Deb, I believe Pete just threw in the chat that he can't unmute himself. And I'm not sure if you wanted to weigh on this a bit, but to my understanding, well, in terms of like the dispatcher now, and Pete or Josiah, correct me if I'm wrong, but I believe the city did receive funding for looking into dispatch and what that and how that could be tailored to meet the outcomes that we're looking for
Yeah,
here in
so
Cleveland.
They did get a federal grant toward the end of last year to work on dispatch and like upgrading dispatch and looking at mental health, getting mental health dispatchers and training for dispatchers so they could be more aware and able to route the calls, that come in for mental health and behavioral health better, and more appropriately. So that's just getting started. They're really bringing people together, trying to figure out, how it's going to look. But it could fit well with this. I think there's a lot of questions still about, I think the city and frontline service, which is doing the care response teams. I think the idea is to have 911 and 988 work together. So you can route calls from 911 to 988 and from 988 to 911 as needed. But it's unclear like how that's going to play out in the long run. I think ideally any call to 911, like they're doing in Cincinnati, they've trained them to triage the calls and send the appropriate calls to the alternative response to crisis teams there. And that's the kind of thing we're hoping that will happen here too, so that people don't necessarily have to call 988 to get this service, but that they can also call 911 if they, because a lot of people don't know about 988. I mean, even though it's been around now for almost a year, right? So, or something like that. I forget. Maybe it's 2 years. I can't remember. But a lot of people still don't know about it, and their automatic response is to call 911.
Just before we go on, I just want you all to know that you cannot unmute yourselves. That's why I asked for people to put their hand up, or you can send me a message. Josiah, did you still want to say something?
Okay, cool. Yeah. And apologies. I missed the decorum at the beginning.
Oh, it's okay.
But yeah, and I think there's several different ways where this can work. I think the best practice overall is to try to have a no wrong door approach to it. Dispatch is complicated. This is a countywide conversation here today. So there is a kind of like cohort of East Side suburbs that are currently engaging in a similar project, which is an interesting way to go about it. It's one that I kind of like because it's kind of focused on the actual mechanics of the dispatch. You can have somebody embedded there that's specifically taking those calls, but that creates a bottleneck. If that person gets caught on a call, right, then like what's your response time? Are other people not being able to receive those calls? I think it is a blend of understanding certain different kind of call types, certain things that are coming in, identifying that quickly and being able to triage that. I think when it's embedded all the way in 911 and there is that interplay with 988 and you have dispatchers talking to one another, and you have folks both with lived experience and people who are from a clinical field being able to work together. I think that's the best idea, so that you can increase your volume, also increase your response time, and increase like the depth of the skill set of folks who are interfacing with folks. And I think, across the board, our dispatch systems are largely antiquated and inefficient. They need a lot more support just across the board. So I think being intentional in this area can really help our dispatch systems in all areas. So that's all I was going to say.
So Pat, go ahead and unmute and you can ask your question.
I wanted to know how this interfaces with the diversion centers.
So, so that's actually a great question, Pat. There has been, I don't know, countless conversations on, people raising the need to, utilize the diversion center more, promote, its open door policy to the community now, and even get, more police officers to utilize the diversion center. How that interfaces with the current pilot that Adams is funding. I'm not sure. To my understanding, there hasn't been like direct strategy around interfacing the diversion center with this pilot. But yeah, that's pretty much all.
Yeah.
All I know of at this point. And yeah, I don't know.
Yeah, I don't think we know yet. I think ideally, and to somebody asked in the chat what the diversion center is. So it's a place, that anybody at this point, if they're having some issue that, they don't really need to go to the hospital, they don't, the police might be able to take somebody there who's having a mental health, behavioral health crisis. It's voluntary, so anybody can be checked in and immediately leave if they want. There's a limit to the stay. It's like maybe 7 days or something. It's meant as sort of this transitional space where people might get some immediate needs met and then ideally help them figure out where they can get more of their needs met. And I think ideally care response teams would be able to bring people there, talk to them. But there's still so much we don't know about what it's going to look like, what the pilot's going to look like. There's a lot of work being done around that as we speak, basically.
So our next question comes from Nina. Nina, can you unmute? You muted yourself again.
Okay. In regard to the diversion center, I hear that there's some serious problems with the diversion center, and there really needs to be more evaluation of the way they operate. So I don't know whether you want to comment more about that, but I did want to ask the consortium of I think 5 East Side cities that are expanding the Shaker pilot. Is that really not a care response model, but the co-response model, at least to begin with, or are they feel that that's a first stage only, and they would move more of a care response after some initial period?
So and thanks for your question, Nina. And your comment around the diversion center. Yes, that is also often talked about around the issues involving the diversion center, people's experiences with the diversion center, and their interaction with interpersonally with the staff, as well as like systemically, and things like that. In terms of the Shaker and Shaker Heights, I believe it's Shaker Heights, University Heights, and
Heights, Warrensville.
Yeah, Cleveland Heights, Warrensville. But those East Side entering suburbs that are collaborating for that model, it is to my understanding a model that mirrors the care response model. I believe Pete, I'm not sure if you have immediate access to the Pete actually did an op-ed, was it, with Amistadi, who was who has been like the lead on developing that particular project.
Yeah, and right now Shaker's technically co-response, but Annette Amistadi, the co-responder there, is doing more on her own and sort of developing that, and she's the one who's helping spearhead this idea of the suburbs, you know, they're all, and Josiah, you know more about this, I think, to some degree about the dispatch, how that, and that the collaboration they've already been doing with the police and some of the law enforcement stuff. So it's helping them come together but the model they're trying to do in the 5 suburbs is care response. It is
Yeah.
non-police response.
Yeah, it's really co-responds right now, just in Shaker, and then she's kind of doing her own like loan response, follow-up sort of situation, referral situation. I think from the beginning, the biggest thing there was the call capacity didn't warrant the manpower that it will require to really run it. Like didn't kind of fiscally make sense. The 5 cities are a part of a dispatch cohort, so they all have the same call center. Therefore, if you're to a previous question about how you get things routed, like this is a way to simplify this, because all of those cities fall in the same call center. They also share a lot of the crisis response, like utility, in a lot of different ways already. And what was it? The diversion center. I'd say the number one thing that really deviates care response from everything is trying to make this non-carceral, making everything non-carceral, right? And so the diversion center right now can't extricate itself from the carceral system, which is, I think, one of the biggest problems and flaws. It's basically an extended arm of the ODRC through its relationship with Oriana House, for whatever that may be. There's tension with the Adams Board. Adams Board is walking away from that, but it's a very slow walk. And so, I mean, I think we're at a moment in time when we're talking about, the extension of the sales tax for the next 40 years, for a jail, potentially courthouse, and all of these things. There's conversations about, the diversion center being at the jail, and like, I don't know about anybody else, but if somebody says they were not taking me to jail and they were taking me to jail, I'd be like, I don't want to go. So I think there's a lot of different conversations about where different kinds of expansion and like what are the best practices? How do we want to build this out? I think these conversations that are happening, I mean, they're happening. I mean, they have been. And we're not going to stop having these conversations. That's what Careful Key is all about, is about having these conversations and digging into this and seeing what the community needs and how we can be supportive around it. But that's all taking shape right now, and the pilot is happening. So it's really important for us to dig in this moment, so that the pilot that does come about from Cleveland, and then eventually whatever happens in these east side suburbs, but the Cleveland one is happening, like it's actually happening. And they wanted it to happen like as soon as possible. So it's really necessary for folks to kind of lean into this process right now and make sure that what we have can garner enough quality results and responses and systems so that we can have something to scale. Because this is, you gotta, like Eminem, like you got one shot, right?
Yeah, and I want to second what Josiah said about the conversation being really important, because we've had over the past couple of years, the conversations and dialogue that we've had have made a lot of this stuff happen. Even what's happening now in Shaker, I mean, the co-responder team, the co-responder work was already happening, but I think because Annette Amistadi was involved in some of our conversations, that influenced how she's been thinking about it. And so it's like, you never know where this stuff is going to go. But I think, these engagement meetings hopefully will really be an opportunity to shape what happens here in Cleveland. And outside of that too, we got to keep, plugging away at that stuff to make sure it's what we really need, and the survey that Bree's working on, hopefully that'll that'll help shape it too, because those are people on the street who are talking about what they need and what works for them, right? So.
Any other questions?
Okay, let's give Bree, Josiah, and Pete a big round of applause, or you can click the applause thing in the chat for their excellent presentation tonight and for their good work that they are doing to get Care for Clee, or to make Care for Clee a reality in Cleveland. I want to close the meeting with 4 areas of focus that CCPC is going to be working on in the next few months. And the first one directly ties in with Care for Clee and is probably the most important focus of our organization and the activist community over the next month. And that is, of course, getting Matthew On elected as county prosecutor. Matthew's campaign slogan, justice for all, directly ties in with what Care for Clee is trying to get done. His opponent, tough on crime, more arrests, more convictions, is the only way to lower the crime rate. Actually, that's the only way to keep the crime rate high. If we get Matthew On elected as county prosecutor, not only will we have justice for all, but we'll also have a lower crime rate because, like Care for Clee, things are more or less headed off at the pass before folks go out and commit crimes. Matthew's not shy about being a progressive. Progressives have made major inroads in our region over the last few years. And Matthew's election, because it will directly affect the lives of so many people, perhaps would be the biggest thing the progressive community could get done ever in this area, not to understate it at all. We have a month to go in the campaign. And we're going to get you guys all kinds of events for the campaign, where you can plug in. They are starting virtual phone banks tomorrow evening, Thursday evening, every week to the election. Okay, those, you just get on your computer, they give you the numbers, and you make the calls. There are weekly canvasses. There are events that'd be great to have a high turnout at. We'll get you those. Probably the biggest upcoming event, it might be sold out already, is the City Club debate on March 5th. But door-to-door, face-to-face communication with voters. Now, Matthew has an army of volunteers throughout the county. Okay, O'Malley may have to pay some people to do this. Oh, sorry, I messed up. I wasn't going to say his name. But anyways, what we need is, and there's going to be a link in the email you get tomorrow. It's going to be in all of our communications up until the election. We need folks to go down to the County Board of Elections when early voting starts and pass out Matthew's literature to folks who are walking in. And it's important to remember too, that okay, those of us who are at this meeting tonight, and most of the Progressive Caucus membership pays attention to things, but there are a lot of Democratic voters who don't. And when they see that contact going into a voting location, that's important to them. And imagine handing them something that says justice for all, okay, right before they go in to vote. Now, that's one component. Okay, early voting starts, when is it? I think Thursday. It's this week. Okay, the other component is on election day. And if you can take a shift or multiple shifts at a polling location to pass out literature for Matthew, that would be great. Now, not all polling locations are created equal. So we can't guarantee that you'll be assigned to your own polling location. And the reason not all polling locations are created equal is some polling locations have like 8 precincts voting, and there's a constant, flow of people going in and out. But your precinct may have only, or your polling location may have only 1 or 2 precincts, and there's not as many people. So what we're going to try to do, what the campaign is going to try to do, is get as many polling locations as possible covered. So if you've got some time to help out for the campaign, please do whatever you can, because like I said, for the progressive community, for the activist community, this campaign is all hands on deck over the next month. Does anybody have any questions?
Steve, there's a question. Is there a sample ballot?
Fortunately, the first answer to that question is no. And that's the sample ballot that the Cuyahoga County Democratic Party passes out to polling locations on election day. But because there was no endorsement in this race, there's not going to be a Democratic Party sample ballot passed out with either Matthew or his opponent's name on it. Now, they may pass out sample ballots for the endorsed judicial candidates. I don't know. But I'm not sure if that's what the campaign has in mind to pass out for early voting or and on election day, or if they've got another lit piece. But the campaign will handle that. I don't think it will be a sample ballot. Anything else?
No other questions, Steve?
Okay. Next big focus of CCPC over probably the next 3 months deals with the fact that the city government and the county government is about to spend hundreds of millions, maybe billions of taxpayer dollars. And it seems like it's going to be once again part of the corporate welfare system. And that is in the form of TIFs and what is likely to come about from the Brown Stadium renovations, which might even be a new domed stadium. First of all, let me try to explain TIFs. You guys have probably seen this in the news, but then when you start reading it, it's like, whoa, it's kind of complicated. Okay. It's being marketed as, infrastructure. And part of it is that, but let me just, try to briefly explain it. Massive development is being planned for all of the property by the river and all of the property by the lake. Now, let's think of each of those individual properties as right now having a property value of right here. And they're paying taxes right now for their property value right here. Now, as development occurs, that property value is going to skyrocket. But the property owners who are beneficiaries of TIF will still be paying property taxes at this level. Now, where is all of that extra money going? For years, there's a point somewhere in the future, maybe decades in the future, where TIF ends. Okay, but where's that money going short term? Well, the proposed legislation in City Council right now has it earmarked to go into infrastructure for those new buildings, but it's quite possible that some of that money will go into the cost of development, which means this extra tax dollar amount, which is huge in the hundreds of millions, is going to be going into the pockets of millionaire and billionaire developers to develop the riverfront and the lakefront. Now, there's 2 things about this. The promise is once the property values get here and TIF is no longer needed, Look at all of the extra revenue the city of Cleveland is going to have. And Mayor Bibb estimates this to be $3.5 to $7.5 billion. Well, a couple of weeks ago, City Council President Blaine Griffin said, well, half of that should go to the neighborhoods. Last week he said, well, maybe 35% is enough. But that money isn't going to be available to the neighborhoods for years, maybe decades. You imagine how long it's going to take to develop the entire riverfront and lakefront? How long it's going to take for the property values to go this high? Another thing to consider. You think developers are going to jump at this opportunity, knowing that TIF is in place? Does anybody remember the development of the flats in the 80s and 90s when they got tax abatement? It was great. I was younger then. I know I went there a lot. Okay. It was great for about a 10-year period. And then they realized they had overdeveloped and all those businesses went under. It's only been the last 10 years or so that the flats kind of got revitalized and wasn't the ghost town it became after it went under. There are no checkpoints to this. And so the devil is going to be in the details. Cleveland City Council is going to take up this legislation end of February, beginning of March, when they're done with the budget. But it is a huge sum of money and a huge risk. Overlay that on top of Brown Stadium renovations, or what was floated last week, a new dome stadium in Brook Park. Cost of the renovations, $1 billion, 500 million of it in public sector dollars. Cost of a new dome stadium, $2 to $3 billion. Cost of the taxpayers, half of that. So, you know, it's where is city council, where is county council going to get the money? And there's always like, and we'll hear this, okay, when all these plans are unveiled, jobs, 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 right? Well, of course, those jobs are available if the millionaires and billionaires develop it on their own, okay? But can that money be used better elsewhere? And as a progressive organization, our take on this is public sector dollars shouldn't go into the pockets of millionaires and billionaires. So, you know, we're going to be following this closely. We may ask you to come to press conferences, to demonstrations, whatever, but this is going to be a big story in our community over the next few months. And just a quick note, you know, on tax dollars. The sales tax that county council railroaded through right before the holidays. Oh, pay for the jail. Well, that money wasn't earmarked for anything in specific, but it was extended 40 years and is expected to yield $4 billion in revenue, which would be enough to finance a new jail, a new courthouse, and a new domed stadium for the Browns, which kind of gives credence to the Brook Park rumors. So like I said, you know, we're going to be on this. We're going to tune you guys in. Please follow the story yourself. Questions on this section? All right, the last two will be short. Number 3, Palestine. As any progressive organization should, we are very opposed to the genocide that's occurring right now in Palestine. We are very supportive of calls for a ceasefire. And so we are going to, well, we have been, but we want to focus on, there are all kinds of Palestinian demonstrations. This Saturday, there's a rally and a fundraiser at the Cretan Center in West Park. You can, on your own, donate to the Palestinian Children's Relief Fund, call your Congress people, urge them to vote for a ceasefire. But right now, the total is 30,000 approximately Palestinian civilians have been killed. So this is a horror story unfolding that, any progressive should get on board, in fighting as much as possible. The last thing, number 4, is citizens, not politicians. The anti-gerrymandering petition is up and running and getting signatures. We're going to ask folks to kind of shift after the primary, after Matthew gets elected, to help gather signatures for this. And that will be a great thing if that gets on the ballot and passes. There's 2 other constitutional amendments. One is the one fair wage. That's to try to raise the minimum wage to $15 an hour. They have been gathering signatures for over a year, and should be done, and that should be on the ballot as well. There is a very good voting rights amendment that our friends from the Ohio Organizing Collaborative and the Ohio NAACP are trying to get off the ground. That's currently in the Ohio Supreme Court, though, because Attorney General Yost didn't approve of the title, which was Voting Rights Amendment, which is exactly what it is. And so the stalling tactic, take it to the Ohio Supreme Court. But hopefully that constitutional amendment gets going as well. And, that may be our most important work in the fall. I mean, yes, defend our country from fascism if it's Biden versus Trump. But if Ohio is destined to be a red state, getting those constitutional amendments passed is very, very important. Any questions before we go? Well, thank you guys very much for attending tonight. In March 27th, which will be the week after the primary, and hopefully we can celebrate Matthew's election. Our March meeting will feature a speaker, Megan Alaba, one of our members. We'll talk about citizens, not politicians, and the signature gathering effort. And we'll have Alina Starks from the Working Families Party, who will talk about the good work they're doing and what they're trying to do as they get up and running in Ohio. Again, thank you. Good night.